Well, this week, the Sacramento County Division of Public Health confirmed an Elk Grove High School student had been diagnosed with active tuberculosis. So we know there are many questions about the disease and how you and your family can stay safe. So we asked the UC Davis Chief Pediatric Infectious Disease Doctor Dean Blumberg to join us this morning. Dr. Blumberg, always a pleasure. Let's jump in. Explain to folks, what are the signs and symptoms of active TB?
The most common manifestations are pulmonary tuberculosis, and so that results in pneumonia that tends to be long-term, results in coughing, fever, and weight loss. This can be very serious.
You know, the news release said that there was no longer a risk of exposure to students and staff, but how can families actually be sure that's the case?
Well, they know the person who was infected, and that person is in isolation right now, so there's no ongoing exposure. And they want to make sure that people who have been exposed get the appropriate testing and the opportunity to be treated to decrease the risk of further transmission and also further progression of disease.
But I want to be clear here. So you talk about it being infecting the lungs, so respiratory, meaning someone may have been coughing, and we know, of course, because of all of the research and the studies and the news that we've talked about, even with the spread of COVID, how far just a cough and droplets can go. Is there a concern even now for the students and staff there? Should they be being tested now?
Yeah, they are recommending testing for close contacts, so that would be classroom contacts. It generally is transmitted after prolonged close contact. So not everybody at the school will be at risk.
One of the things you mentioned is treatment. What does that include?
Well, once they find people who actually have been infected, the thing about tuberculosis is there's a very long latent period between infection and actual progression to disease. And so we have the opportunity to treat people who are infected before they get sick, and that'll reduce the risk of reactivation and cause of disease by up to 90%.
And again, what specifically would that treatment entail?
Public health will take care of that treatment based on the individual considerations of that student or staff member, and they'll make sure they get the appropriate treatment to decrease risk of progression.
I mean, but is there, just in generally speaking, is there a shot? Is it some type of antibiotic? What is it that these families should be even perhaps talking to their doctors about?
Yeah, it's an oral medication, and it depends on the specific case and the sensitivities of the infecting organism. So public health will have that information and know the best antibiotic to give. It's generally an oral therapy. The oral therapy can either be given daily, depending on what it is, or sometimes it's given weekly for several weeks.
And Dr. Blumberg, is there a vaccine available, a TB vaccine available as well, and is it required for students?
There is a TB vaccine, but it doesn't work very well. So in the U.S., we don't recommend this vaccine in general, and it's not required for students for school.
All right, a lot of good information. Hopefully that answers some questions for families and students there in Elk Grove. Always appreciate your perspective, Dr. Blumberg. Thanks so much.
Thank you.